My name's Russell Owen, and I had a total knee replacement in November, and I'm a patient of Nell's. So I was very surprised that prehab was recommended, being a fit and healthy person, I thought. Um, but there were clearly a few things that needed addressing. So the big thing that surprised me during the prehab assessment was the realization that because I'd broken my toes a few years ago, I'd not been walking properly for years. And that effectively um, messed up the way the muscles in my legs were working, which obviously affects the knee as well. In addition, because of my broken toes, my balance had gone to shot. And I'd never realized that because I thought, well, I always used to be able to balance on one foot, but until it was tested, I really never knew that I couldn't. So my prehab sessions lasted about 5 months, I think, before operation. And it really helped because it not only prepared me mentally, because I had lots of conversations with Nell about what was going to happen, but it also gave me the confidence that the exercises I've been doing kind of put my body in the right frame of mind, if that's the right expression, so that when I came out of the operation, the body was ready to start healing itself as soon as it could. Before the surgery, I wasn't in any pain, and this is because of all the prehab exercises I did. Post surgery, I was amazed, to be honest, that I only needed to use crutches for a day whilst I was in hospital. And this was contrary to all the horror stories I've been told by friends of mine who had knee operations that, the pain was horrendous. They couldn't sleep because of it. And it took them ages before they were able to get off crutches. So after the operation, I came back here to my little small holding in the middle of Wales and immediately contacted a local physio. Um, he was very impressed with the speed of my initial recovery. And together we reckoned that was really down to the exercise regime I had done in prehab. So the one thing I'd say to anybody that's contemplating this sort of surgery is spend as much time as you can doing prehab. It really does strengthen all the muscles around it, and it gives you that mental confidence as well. So when you go into the operation, you know everything that's going to happen, and you'll come out of it in a much better position than you would have been had you done nothing.